hand over to Dr. Rakib Chowdhury, who's a GP in Leeds, and he's the founder of Hummingbird Medical. So I'm sure you'll see that Rakib's got an innovative product called Book Your GP, and this is aimed at intelligently managing and coordinating patient recalls. So I'm happy to hand over to Rakib if you want to run through your offering.
Absolutely, yep. Thank you for having me. I'll just try and share my screen. Let me have a look. Screen. Yeah. So, can everyone see this?
Yep.
Yep, fantastic, great. So I've shared my screen correctly. So a quick PowerPoint. I'm not going to go through a lot, but probably just a quick overview. So I'll just start with a little story, and this is essentially how we got started in this. So when I was a junior doctor, this was around 2016, 17, around that time. I was in a large GP surgery in Leeds, and there was a chap who came in with back pain, and you know, about 1 out of 3 people in the UK get back pain at some point. And this chap was kind of your typical back pain patient. So he seemed all muscular, nothing too worrying, but he kept on coming. Saw a few of the GP partners and was given some painkillers. When he came back, they decided to do some blood tests. And then the patient didn't attend for his blood tests. And he kind of got lost to follow up, essentially. A few years later, the back pain was even worse, kind of keeping him up at night, stopping him from getting to sleep and things. Had the blood test, and it turned out that the patient had metastatic prostate cancer. So this patient took 3 or 4 of the GP partners to court, basically, and yeah, it was just a very traumatic experience for the surgery, of course, and you know, it made me think there's probably a lot of these types of cases going on all through the UK, and I was thinking, you know, is there a way of actually using software to automate reviews, coordinate care, and improve communications between surgeries and patients? And there's loads of cases. So I've got a few case studies here. I'm not going to go through all of them, but I think just to illustrate what we're dealing with, it's a good idea just to have a chat about a couple. So these are all real cases, and I've got a bibliography at the end of this if people want to have a look. But yeah, another case is a 53-year-old gentleman. He's tired all the time, has blood tests, and is anemic, which is a bit of a red flag when it's a male and he was over 50. GP did the usual thing, asked the team to contact the patient to attend for further tests. Patient didn't arrive. Patient arrived 6 months later for a follow-up and was referred under the cancer referral pathway and was diagnosed with colorectal cancer. Patient sues all of the GPs that were involved in the care. The reason is that if you don't tell patients why they need the follow-up explicitly, then it's the doctor's kind of responsibility, and the burden of proof falls on the GPs or the doctors or the surgery's shoulders. I won't go through all of these, but I think this is another interesting one. So it's a 52-year-old lady. She asked for a home visit because she's feeling dizzy. Junior doctor goes to visit her, feels like the blood pressure might be a bit low, causing the dizziness, so stops the medication. A week later, the patient is still dizzy, so calls for another home visit. This time the senior GP goes and visits and notices that she's on lithium, which is a kind of a mood stabilizing medication, but very toxic. So the GP decided to do a blood test, which was meant to be done every 3 months. Essentially, after a lot of back and forth, the levels come back very high, and the patient gets admitted to hospital urgently due to lithium toxicity, but the patient's left with permanent ataxia and dysarthria, meaning that she can't move properly or speak properly. So she sues everyone, including the GP, the junior registrar as well. It's just a taste of what's going on in primary care. I mean, we deal with 90% of patient contacts, and we prescribe the most medications out of the whole of the NHS. And this kind of sums it up. So according to NHS Digital, litigation is increasing by 10% a year in general practice, and medical comorbidities are going to double over the next 10 to 15 years, according to the ONS. And none of the solutions are very good at dealing with this. We're using systems which are 20 years, 30 years old sometimes, to kind of manage this. And the complexity, as the comorbidities increase, the complexity increases, because multiple comorbidities means that instead of maybe 1 or 2 reviews a year, you might now have 4, 5, 6 reviews a year. So it's very complicated. So the solution, in our opinion, was to make good software, and we think that we've gotten quite far. So we're currently serving tens of thousands of patients in Yorkshire, and we've had very good feedback. I'll give you a quick demo of the app. So the app is called Book Your GP. This is a test server with all fake patients and fake patient data, so there's nothing being breached. In the app, we'll walk through it and we'll do a very quick tour, but the app has a full calendar system, and it has a full kind of disease and cover system. It'll all make sense as we go through it, but the app comes preloaded with all sorts of diseases and risk stratifications and vaccinations preloaded into it, and you can set it however you'd like. So if I click a hypertension with a blood pressure over 159, so it's a risk stratified group of patients, you can set what you would require doing at each review. You can set staff profiles. So our example nurse here, she can do the following things. So the app knows who can do what and how long different conditions and tasks take. And we have a fully fledged kind of calendar system as well. Probably don't have time to go into all the ins and outs with this one, but it's very kind of intuitive, and it has like all the functionality require it. You can essentially add diseases to different appointment slots. So again, patients can get recalls and then book directly into the appropriate slot, because the app knows who can do what and how long each thing takes. We'll jump straight to the recalls page, because that's probably where the majority of the work happens. Again, this is all fake data. So when you go to the recalls page, it's just a big list. In the outstanding tab, you have a list of patients that haven't had their reviews done and are due their reviews doing. And you can communicate with the patients directly from here as well. So for example, if we want to send Marnia Pitt a quick recall, you could just click the text message, say, you are due a review at the surgery, please contact us. And then say that you want to contact the patient again in about a month's time or 2 months' time. It's up to you. We'll do a month, and you can just put that date in, click send, and the text message will get sent off. When that happens, that patient will now end up in the pending tab. This is where all the patients who have been contacted will appear. So for example, this patient is now here. You can see you've contacted the patient once, and you can see the message you've sent and when the patient will reappear in the outstanding tab. Once the recalls are sent, everything gets recoded into the electronic health record, so that the surgery gets paid for their QOF or CCSP contracts or any other contracts they have. And we also have a full kind of vaccination list, all your smears and baby vaccinations, all your shingles vaccinations, 70 to 80 on there. The app is very malleable, so it means that any kind of thing that the surgery would like to monitor, it can be put on the application. So for example, if there's a GP with a special interest in diabetes, and they say, okay, anyone with a foot ulcer needs to be reviewed, every few months or every 6 months, then you could put that onto the app. So you can put anything you want, and the app has everything on it. So if we go to the search tab and we search like methotrexate, which is a controlled immunosuppressant drug, it will show you who is due the methotrexate, but it's calculated it for the whole of the year. So you can do some workforce planning as well, so you know who is due what and when. If we go to the recall settings, you have a lot of features here, and you can tweak the recalls basically. So if, for example, amiodarone, you want to do an ECG, which you're meant to do from time to time, you can add that in there as well. And the app essentially listens out for when the patient has had an ECG or a user needs, in this instance, in the patient record itself. So there's no way of tricking the system. It's completely medico-legally robust. So if the patient cancels or DNAs an appointment, the patient will continue to get recalled into the surgery. And there's a automate feature as well. So if you want to automate, for example, your amiodarones and say you want to contact, 2 or 3 patients a day, you can just set that in and the patient will get automatically contacted. So you can automate your disease registers as well. So in a few surgeries now, we're already automating amber drugs and high-risk disease, high-risk diseases like CKD4/5, so end-stage renal failure. And you have a whole host of other features as well to help you get on with your work. So probably out of scope for today, but that's basically a quick kind of whistle-stop tour of the whole app. You can, one last thing which is pretty cool, you can do ad hoc recalls as well. So if you find, if you go to patients, all of your patients will be on there for your surgery, and you can just click on one of them and you can add your own recalls in, of course. So if you want to do a blood test and you want it to be a use and ease, for example, again, and you want it doing it in 3 months' time, again, this will just get automated as well if you choose it to be, and the patient will get recalled in for that. So it's completely kind of medico-legally robust system. Right, and so jumping back to a little bit of the presentation, there are a few findings. This is just a quick pivot table we made for a surgery that will remain anonymous, but this is very typical of what we find. We find that the majority of patients out there have some kind of monitoring requirement that isn't done. So these are the years. So 2018 to 2022, we calculated it for surgery with our application. You can see that in 2018 there were 737 recalls out of 5,365 which were due and have not been done. And if you click on this, you can see which disease registers were missed out. So there are a few scarier ones in there, like there's someone with heart disease with a blood pressure of 159. There's a few diabetics, 3 diabetics with an HbA1c over 75. There's all sorts of blood thinners which obviously should be being monitored, and this is very typical. We haven't ever found a surgery that has less than 30% of patients who have gone missing to follow up. So it's a really big problem that we think needs to be addressed. When we analyzed the data and how well the app's working, and we find that our application saves about £4,000 per 1,000 patients a year. So it's quite a large cost saving. Savings due to phone bills being reduced, letter costs being reduced, and text messaging being reduced, because all of our services are being provided by the government, so everything is at cost. So it's much cheaper than what surgeries are using now. Also, the administrative work is massively reduced as well. Obviously, there's reduced workload as well, and less work for GPs and admin teams and less meetings. This is an audit from a couple of years ago when I was a GP partner, and we found that we did a quick kind of audit over a month, and we found that the app did about 70 recalls. We saved about 31 GP appointments as well. A lot of these were because of better communications with patients and better safety netting. And that's kind of it. It's just a snapshot of the sources if you'd like to have a look. But yeah, that's the end of my presentation. So I hope that was quite interesting. And yeah, if you've got any questions, I'd love to hear.
That's great, Rakib. Really interesting offering. It's a clear user case of bringing value to primary care. So I've just got a couple of questions. So in terms of your current projects, what projects are you actively involved with at the moment with your product?
Yes, so we are in quite a few places now, and so we're at about I think probably about 7 or 8 sites in Leeds at the moment. Each surgery is obviously quite different. So one surgery in Leeds is probably the furthest ahead, and they're automating a lot of things, and they're just adding 1 disease register every month. So they're automating CKD4/5, methotrexate, mycophenolate, some of the blood thinners. The next, they're going to be doing some of the other more kind of high-risk disease registers. We've launched it in a smaller surgery recently who are now using it for all recalls, including ad hoc recalls. And then we are also in, thanks to the AHSN, thank you very much. We're actually working with the chair of the Rotherham CCG as well. So we're in 3 sites across Rotherham, serving about 15,000 patients there as well. And again, I think they're just trying to grasp the scope of the work because they are big, more complex. And I think what we do for the larger surgeries is that we systematize how they do their recalls. One of the problems is that currently a lot of this stuff is knowledge based. So what happens is that there'll be someone in charge of doing this stuff and keeping an eye on things. But obviously people retire, people leave, and people are unwell. And then when that happens, the whole system that they have in place often kind of disintegrates. So we see our platform as a kind of, a framework for the surgeries to work off of. And it retains the knowledge, so it means that the organization can function even without certain key people. It can continue to work safely and effectively.
Mm-hmm. Yeah, that makes sense. What are your ambitions for your product in the Yorkshire and Humber region? Sounds like you've got some interesting projects already in flight. But
yeah, well, I think our main aim at present is that we want to obviously get bigger. It would allow us to get more revenue, to build more features, and we want to obviously integrate with the main electronic health record suppliers as well, which we'll hopefully be doing later on this year. I think that's kind of like short-term goals. I have to say the integration hasn't been much of an issue because it is all automated already for the surgeries, meaning that they're not having to do what they currently do, which is like export and import a bunch of files. Everything is done on their behalf, including all the read codes. So those are kind of short-term goals. I think the long-term goal would be hopefully kind of making healthcare just more decentralized. There is no reason why you cannot have like health pods or get help from third parties like pharmacists who are hooked up to our app. So if you are a hypertensive patient and you just need a blood pressure check, why is it that you have to come to the GP surgery for a face-to-face or buy your own blood pressure monitor? I don't see any reason why you can't go into a health pod. You get recalled through the pod. You can choose where you want to get your blood pressure done. It could be at your local pharmacy. It could be in a local health pod of some such. And everything gets fed back into the patient record. And I think that would be the long-term goal, and just trying to make healthcare more accessible for people who are working, not currently where they're registered with. I think it would have a very big impact on a lot of different aspects of healthcare if we manage to do that.
Mm-hmm. Yeah, and how can people contact you for any follow-on discussions, conversations, etc.?
Yes, so you can just email me directly. I think maybe the people who are present on this call would probably get my email. Alternatively, you can just go to our webpage. So you can go to hummingbirdsmedical.com. There's a contact page there. If you send it there, I'll get the message. So if you would like to have a chat, I'm more than happy to talk with you.
That's great. Thanks, Rakib. So we'll move on to Maisie, who's the commercial executive at Promatica Digital. This is a supplier that's, again, based in Leeds on our doorstep. They have a number of products, but today Maisie is going to be talking through her social RX